Do you want to know what scares many parents? Fevers and the risk of seizures. In this video, I want to talk about febrile seizures. What are they? Can we prevent them? Can they affect your child's development? Will my child always have one if he gets a fever? But first, I'm Dr. Carolina Melgar. I'm a cardiologist and I'm focused on preventive medicine. And I'm also a mom. I want to teach you how to prevent diseases using science and common sense. So let's get started, shall we? So febrile seizures occur in 2 to 4%, usually between the ages of 6 months and 5 years. It happens when your child has a fever with a temperature above 100.4 degrees. I don't know if you ever saw one, but it could be very scary. I know I've witnessed my share as a doctor. The good news is that febrile seizures don't have longing effects, and they don't drastically increase the risk of developing epilepsy. Now, if your child has a febrile seizure, there's a chance that he can have another one. It's important to know that they depend on the age. The younger the child, the more risk of having it, but as he grows, the risk is lower. Now, what's very interesting is that although febrile seizures can happen when there's a fever, not all fevers can result in a seizure. And it doesn't have to be a very high one. Even a temperature of 101 can happen. Now, it's a mistake to think that all fevers are going to lead to seizures. Now, I'm going to be showing some videos of children with febrile seizures because I can talk about it, but if you don't see it, it's hard to understand it. So go ahead and skip it if it's not something you want to see. Take a look at this. This child looked like he's zoned out. He can't pay attention. He doesn't respond. Look at the blank stare. Sometimes they could be twitching or rolling their eyes. Now look at the stiffness in this baby. You can actually see how he has these small rhythmic movements. In the second video, you can also see the stiffness in his arms and the blank stare. And in this case, the body's movements are rhythmic and they can't stop him by holding him down. It's very different from a tremor because with a newborn that has a tremor, you can hold him down and it stops. But seizures won't stop even if you're holding down. Some children can drool, they can vomit, they can even urinate, but those are less common symptoms. Now, I know it's very scary, but the good thing is that most seizures last only a few minutes, and most children go back to normal after it. But listen to this. Sometimes after the seizure, they can get confused or agitated or even tired. This is called a postictal state, but it also lasts about 5 minutes. If your child ever had a seizure, my heart goes out to you. I was holding my nephew in my arms. He was 2 months old and he started having a seizure. It's very scary. It truly is. So let me give you an advice as a mom and as a doctor. First, try to stay calm. It could be very scary to watch, but if you stay calm, you can do so much more to help your child. First of all, make sure that he's in a safe environment. Move him carefully to the floor or to the bed or a couch and try to move away from him everything that can hurt him. Turn his head to the side and never put anything into his mouth, not even fingers or clothes or spoons. Let me take this moment and share with you what is a huge misconception, that a child may swallow his tongue. Now, I've heard this a long time ago. It's really impossible, and some people used to believe that by putting a spoon or their fingers in there or something in his mouth, they could prevent that. But trust me, it's not like that at all. If you put something in his mouth, you're just making him more uncomfortable. Now, and actually, if you put your fingers, he could actually bite you. So if you put his head to the side, it'll make him easier for him to clear out any drool or vomit from their mouth. Now, what I'm going to ask you, I know it's hard, because when your child is having a seizure, 1 minute can feel like 20 minutes. But try to time it. This is very important for us to determine the diagnosis. If the seizure lasts more than 5 minutes, call your doctor or 911. And if after the seizure your child is not waking up, also call 911. Okay, now if your child had a seizure and it was less than 2 minutes and now he's acting normal, what do? I want you to call your doctor or go to the emergency room. It's very likely that the fever was caused by the virus, but I'm sure they're going to do a complete blood workout. So just to be sure that nothing bacterial is affecting him. Now, if that's the case, he's going to need antibiotics. Always remember that febrile seizures don't cause brain damage. They can be very scary to see, but the good news is that most children outgrow them by the age of 5. So I hope you found this video useful. I really enjoyed making it because it's very common that my patients ask me about their children, and I would love to know about your experience. Has your child ever had a febrile seizure? I want to see your comments below. So make sure to subscribe and take care.